My mother and my grandmother suffer from diabetes for more than 20 years. They try to keep their secret. They don't want to share with anyone because and someday they feel very lonely about how they fighting with the disease. I want to focus on that and I think I can change something even not for the healthcare system but for my family.
Hello and welcome to the Demystifying Healthcare in Vietnam podcast. I'm Beth Ann Lopez, founder and CEO of Docosan. We're on a mission to make getting healthcare effortless and bring you insights from Vietnam's top players in healthcare. On this week's episode, we're going to speak with Nhat Luong, co-founder and CEO of Diabe, a healthcare platform offering a holistic digital diabetes education and self-management program, including lifestyle coaching, remote support by specialized doctors, and lifestyle experts. So before starting Diabe, Nhat worked in senior management roles in healthcare in Vietnam for over a decade, including at Quan My Medical Corporation, Han Phuc International Hospital, and City International Hospital, as well as an external advisor to PwC and Bain & Company. He holds a master's in finance from Monash University in Australia and an MBA from Reichman University in Israel. So he's got a very international perspective. So it is fantastic to be here with you today, and we are going to talk about diabetes, the fastest growing disease in Vietnam, according to the World Health Organization. And so in getting started, Nhat, what is awareness and education like for normal people living in Vietnam around diabetes?
Okay, fellas, thank you for inviting me for today. And very nice introduction. So, you know that in Vietnam, there are nearly 6 million Vietnamese suffer from diabetes. And only 60% of the patients were diagnosed and remaining 40% in undiagnosed. So it means that some patients, they suffer from disease, but they don't understand they suffer, and they ignore that. The second thing is that some patients who diagnosed for a long time, more than 10 years, but they not understand by their disease and they don't know how to manage their disease. And so if for example, some very popular KPI like HbA1c to measure average the blood glucose for within 3 months, some patients, they don't understand that. And when they receive the diagnostic report, they don't know what their condition. So that is the issue in Vietnam, yeah.
Wow, yeah, so kind of lower awareness and education levels. And then what is life like for people who actually have diabetes?
So I think that the patient who suffer from diabetes, they have very low quality of life, So some patient, when they were diagnosed, they were scared about the disease, and they try to keep very harsh diets, and they try to abstain from some food, even their favorite food, and some food good for health, they still abstain from that because they don't have knowledge and skill to identify the good food for their condition. So there's another things. The patient, they have to taking medication very frequently and every day, every month, and they have to visit the doctor for the routine checkup. And someday they feel tired of the taking medication and they stop taking that, and suddenly someday the complication happen and they realize that's too late for them and they have to struggling with the complication. So, some example of the complication like heart attacks and stroke, some microvascular complication, eye amputation, that is example of complication, and the patient have to struggling with that every day.
Yeah, very serious. And then where do they typically get their education from?
Right now, they have two channels to get the information about their disease. The first that come from the doctor, where they visit the doctor every month. The doctor will explain about their disease and how they can manage their disease at home. But you know that the doctor in healthcare system in Vietnam, where they have the limited times for the patient. For one consultation, they spend nearly 3 to 5 minutes with the patient. That's not enough time for explain about how to make the patient understand about their disease. The second thing is some physician, they don't have expertise on the how to follow up the patient, and expertise on lifestyle change, because you know that lifestyle very important for the patient, including nutrition, exercise, and how to manage their stress, and how to identify the complication, including chronic and acute complication. So that is big issue. Yeah.
I see, I see. And so then when it comes down to treatment options for these patients, what is a typical course of treatment like in Vietnam for them?
I think there are two types of the treatment. The first one is the traditional treatment. It means go to the hospital or clinics and see the doctor, take medication, and they adhere to the medication treatment. Yeah. The second things, they focus more on the lifestyle change. It means they have to adjust their lifestyle, eat healthier, do more exercise, and they keep away from the stress and anxiety, make them more healthier, yes, lifestyle.
I see. And how do they find out about these lifestyle changes and know what is a healthy lifestyle and what's not?
Yeah, because as I mentioned that the doctor have limited time with the patient, so all the information about lifestyle they will find in the internet. Yeah, but
Just
you know
online,
that.
wow.
Yeah, information in the internet very, I mean, distorted, right? So they some information just support for any individual purpose, like supplement cell, for example, and some solution that not proved by the scientific research. So yeah, I think the patient look like in the maze, they have to find what is the right information for them. They have to filter by themselves, and yeah, I think that's a
That's so difficult. So they're really kind of on their own to navigate, the wild of the internet, disinformation, kind of short bits of information they get from their doctors, but
Yeah.
they don't have a lot of trusted sources.
yeah.
Okay. And so how is the situation about diabetes in Vietnam different from diabetes in other countries?
Yeah, so about the healthcare system first. So when the patient in developed country where they was diagnosed with the diabetes, they have to admit to the educational program, and the insurance will pay for that program.
Does everyone have insurance?
Yeah, because you know some, for example, like US, the most of the people they have the private insurance and some corporate health plan that's cover for them, and for the some under sorry in some like the patient they don't have the insurance, the government they have the some Medicaid and Medicare for them, right?
Yeah.
So and they also pay for that because because you know education is the best way to support the patient, then help them to manage their disease, and when the patient they understand about their disease, their outcome will be improved, and that will make the healthcare cost reduce.
Absolutely. So are there many insurance companies in Vietnam that cover educational programs?
Yes, certainly no. Yeah, so even the social insurance and the private insurance, they don't pay for preventive care, and some so educational program is the same. They don't cover for that. So that's why the some healthcare provider they don't have motivation to offer the educational program for the patient. Some hospital and clinics they try to do that, but they just try to do some occasional educational class that's not routine and not comprehensive to for the patients. Yeah.
I see. So it's still a little bit old school. You just try to treat the symptoms, and then, the patient is on their own
Yeah.
otherwise. More
Yeah.
like sick care than
Yeah,
healthcare.
they just focus on the diagnostic and the treatment only. About the follow-up, about the educational, is not their focus. right now. Yeah.
I see. And so, what do you think is the biggest issue for diabetes patients in Vietnam?
Yeah, I think there are two things. I think the two things important issue in Vietnam. The first thing is, as I mentioned, that education. So the patient, they don't have any educational class program support them to improve their knowledge and skill to manage their disease, and the doctor have no time and no expertise to support them. The second thing is the healthcare in Vietnam very fragmented. I mean, what I mean is connection between the patient and the doctor is very limited. They just have few minutes during the consultation, and the doctor more focused on the treatment and diagnostic. They don't have focus on the patient follow-up. So the second another things is the connection between the doctor, I mean the GP, with the specialist who treating some complication. There is no connection and no data sharing. For example, one doctor, they prescribe the lab test for the patient, but when the patient see the specialist, they still prescribe the same lab test, even they don't see the result from the previous test. So that's why they make the healthcare cost very
So it's
high.
duplicated because they're just
Yeah,
not talking
duplicated,
to each
yeah.
other or sharing any information.
Yeah, similar for the medication too.
Yeah.
Some medication interaction, the doctor prescribe with medication, but the others prescribe some drug interact with the last prescription. So that's make the outcome is not really outcome result very low. I think so.
Yeah, geez, so a lot of change is needed. And so Nhat, you've now dedicated your life to addressing this disease. And so before we get into what Diabe actually does, what is it that motivated you to start Diabe and tackle diabetes as your issue?
Yeah, I have nearly 10 years working in the hospital, and during the times with the hospital, I saw 30 to 40% of the outpatient in the hospital is the chronic patient. So they visit the hospital very frequently, every month, every quarter, to see the doctor for 3 to 5 minutes and take medication. And we found that the patient have very low quality of life. You can see the patient in Vietnam, diabetes patient in Vietnam, very different from others. They think and they pale, so different from others, very obese and overweight.
Yeah, because definitely in the West, the kind of perception is that you're very overweight. People really try to get them onto lifestyle programs to lose weight, manage their blood sugar. But you're saying that in Vietnam and in Asia, some people might still be thin and or at least like not obese and have diabetes.
Yeah, because they keep very harsh diet and abstain from others nutrition that good for health even, and I think they have the problem with the mental too. They feel very stressed about the disease, and they try to suffer the disease by themselves. So that makes them just suffer from that.
Well, it sounds very stressful.
Yeah.
Like you're on your own to figure out how to manage a terrible disease.
So that's why I wish to find any solution to help the patient to live the life they really aspire, not try to suffer from that, but enjoy with that. Yeah, that's the way we try to build the diabetes. Moreover, my family member also suffer from diabetes. My mom, my grandmom, they got the disease for nearly 20 years, and we understand what they feel, and
so what was it like for them going through diabetes?
yeah, they live with their disease alone. They never share about their condition.
So they didn't talk about it with anyone?
Yeah, they never talk about that.
Why were they so quiet about it?
Yeah, I think that is the culture, and they consider disease as something weird and they don't want to share with that. They don't want to share with anyone, and they try to keep that for themselves. And yeah, that's the culture. I think so.
Oh, that almost makes it a little bit more scary and difficult too, having to really face it on your own.
Yeah, yeah, yeah.
I see. So a huge amount of unmet need in diabetes care.
And you know that for the Vietnamese young population now, so many the obesity rate very high increasingly. So for the near future, next 5 to 10 years, the number of the diabetic patient will become more popular. So I build this solution for our generation because unhealthy lifestyle will lead to the chronic disease. So we build for the future.
Yeah, absolutely. It'll unfortunately keep growing as people get richer and unfortunately lifestyles get worse. And so, what is it that Diabe does?
So Diabe try to offer 4 solutions to the patient. The first one, we offer the self-management and educational program that's were digitalized and empowered by the coaching service because very difficult for the patient to accept the new healthy behavior because very difficult. Just example, to take the shoe, get the shoe and run every day.
Yeah, of
very
course,
difficult
that's the
for
hardest part.
someone not familiar with that. So behavioral science is very useful for Vietnamese patient. We offer the coaching service to help them to change their behavior. That's why we try to mix between the diabetes educational program from the ADA and the coaching service to offer to the patient. As the second solution we offer to the market is the community. The patient very lonely, and they try to keep the disease secretly, as I mentioned. So we try to build a community. We want to make the patient feel connected and familiar. They can find any peer who suffer the similar condition. They can share about experience, share about how they can fight with the disease. It make them feel disease not something different. So and yep, something like that. The third solution that we offer to the market is the mobile application. Because the patient don't have any tool to manage the disease. For example, like reminder for medication and tracking. There's some clinical KPI like blood glucose, blood pressure, and weight. So we try to integrate some medical device into application to help the patient track their condition frequently.
What kind of medical devices?
Blood monitor, blood glucose monitor, and blood pressure monitor, and we integrate with some health, Apple Health, to track some activities for the patient to make sure they're more active. Yeah.
Great. And how is this different from other solutions on the market?
Yeah, in the market right now, they have 2 solutions. The first solution is the traditional healthcare. It means the hospital, clinics. Then the patient visit the doctor and take medication. The second solution is the lifestyle intervention. So like nutrition, and there are some nutritionists. They try to convince the patient that the nutrition is the best way to manage the disease.
So, yeah, what does Diabe do?
So actually, we offer the 4 solutions to the market.
But when we look into Vietnam, still most of healthcare is still offline. And so what do you think currently about digital platforms and interventions in healthcare in Vietnam?
So I think the 3 things make the digitalization is slow in Vietnam. The third thing is perception, because Vietnamese perception still believe on the physical healthcare. They still think that face-to-face is the best way to communicate with the doctor and make the doctor understand their condition. So that's why they still refer for the physical care. The second thing is about the tech familiar. So some old population, they're not familiar with the tech and they don't feel comfortable to using any tech solution. And but I think for the next generation, everything will change. For next 5 years, when the young population become older, tech familiar is not an issue anymore. And the third,
With diabetes, do you see any younger people using your coaching programs or maybe even using it for their parents?
yeah, the diabetes now become younger. Like some patient just 35 years old, they diagnosed with the diabetes. So our focus is from that. We focus on the young population because for the young population, very easy to convince them to use technology for manage their disease. But that doesn't mean that we ignore the old population. We still support old population. We had a team, very big team, to support the old people to get familiar with the app. We spend time with them and support them with the most easy solution. For example, we still help them to use some very easy communication platform like Yellow, for example. We still integrate our solution into the Yellow to support them because platform alone doesn't work for the old people. We have to find all the popular platform to support them because most of Vietnamese, even the old people, they use the Yellow, for example.
Yeah. So, I mean, some older people are using a lot of tech in their day-to-day lives. They're just, I guess, not familiar with new stuff. And so you bring the tech to the user where they're at instead of making them learn something new.
Yeah, right.
Okay,
Yeah.
great. And what do you think we can do to accelerate the adoption of digital technologies in healthcare in Vietnam?
Yeah, I think because all the healthcare innovator, they try to fix specific issue in the market, right? We can fix everything, right? You have to choose specific things to fix, and to make our solution sustainable, I think we have to be patient in terms of the financially and mentally. It means you have to keep your motivation alive, and so I think all the healthcare innovator to sit together and find solution, integrated solution to offer to the market. If we just stand alone, for example, you try to fix specific things. If you can integrate everything in one integrated solution offer to the market, I think we can make digitalization faster, grow faster, and something like that.
That's great. Well, that's something that I'm so excited about with our collaboration between Docosan and Diaby is addressing that fragmentation and making it easier for patients who need diabetes care. Maybe they don't even know about, that they actually have diabetes. Yeah. Making sure that they are not alone, finding and connecting with you guys who are the experts and helping them get better and manage their diseases.
Yeah, I think we when we want to change the healthcare, redesign the healthcare, you have to think the patient in the whole condition from the day they was diagnosed until when they're at home and fighting with their disease when they're alone. So we have to look at the full picture of the patient and create a solution that integrate everything from that. I think integrated solution will be changed and redesign the healthcare.
Yeah, I think so too, Nhat. Well, thank you for this absolutely fascinating conversation. It shows that there's a lot of work to be done in digitizing healthcare, but especially in bringing diabetes care and education to the homes of patients. So thank you for that. Our listeners can find Nhat on Docosan, on LinkedIn, and at diaby.com.vn. The links are in the description. So thanks for listening and catch you on the next episode.